My name is Mary Krauland. I'm a research assistant professor. So I do agent-based modeling with the Public Health Dynamics Laboratory. I actually work mostly on infectious disease modeling now, but also modeling opioid use disorder and overdose. So we did an after-action report for the Pennsylvania Department of Health on what would have happened had there not been non-pharmaceutical intervention. So not having shutdowns and closures, school closures and masking, etc., in the time before the vaccine was developed for COVID-19. And that work demonstrated that there would have been thousands more deaths, actually tens of thousands more deaths in Pennsylvania, had those non-pharmaceutical interventions not been put in place. We've also done a lot of work on vaccinations. So, for example, vaccine hesitancy can cause a big rise in what used to be called the childhood diseases. So specifically measles we've looked at, where vaccine hesitancy, particularly when it's concentrated in, for example, a single school or neighborhood, can result in very large measles outbreaks when an infectious person introduces the disease into the area. So I think most students actually know anything I would tell them. The most important thing is, do your work and just be very proactive about deadlines on big deliverables. So for example, an essay, a thesis, a dissertation, you should always have kind of a focus. Even when you're busy with classes, you should have a focus on how you're going to do that and on getting that done in a timely manner. And also on trying to find something that you're really interested in doing, because the more interested you are, the better you're going to do and the more fun it will be for you. So one of the great things about Pitt, which is sort of related to academics, but I'll say it anyway, is just the cross-disciplinary nature of Pitt. So because it's such a big school and it has public health, but it has GISPIA, it has a law school, it has all these other schools in addition to public health that a public health student can avail themselves of the resources of those and can work with people from those areas. And in fact, you're often encouraged to include them in your committees.